Oh, okay.
Yeah.
Who else?
Anyone with this is Medicaid, come on.
Okay, this is Medicaid. All right, thanks, everybody. We're gonna get just started. There's one change in our lineup of speakers. The last person,
Minnesota. At the ARC, we work to promote and advocate for the human rights of people with disabilities. This is Medicaid is a broad coalition, diverse statewide coalition of over 50 organizations, partnering to protect has been signed, published, and of which we have printed copies here. Follow up with one of us after that if you would like a printed copy. This letter urges our state legislators to work constructively and collaboratively in changes may bring to enrollees. We especially highlight opportunities for easing administrative burdens, clarifying and defining exemptions in policy where appropriate, and streamlining data processes. Continuity of care Minnesota impacts, and some other handouts available with us today that showcase some of the changes we expect to occur to Medicaid this next year. This is Medicaid Coalition intends to be a source of support, technical assistance, and expertise all just came up from a legislative briefing. So we'll have the same speakers, except as Laura mentioned, Jillian Nelson won't be joining us today, but we've got Kurt Rutzen who will be reading on her behalf. I'll be introducing each speaker and
being here. My name is Sarah Linbo, and I'm here today to represent both Gillette Children's. I'm a new employee there, but really I'm here to speak as a mother. I have an amazing daughter named Greta, who is 14 years old, and she has cerebral palsy, and she's been a patient at Gillette for palsy is a lifelong neurological condition that affects movement, muscle tone, and coordination. It does not get worse over time, but we're learning with Greta that as she grows and gets older, the challenges become a little bit bigger and honestly a little bit harder. So her official diagnosis is that she could get all of her needs met. Our very first doctor at Gillette is named Dr. Deshpande, and she has been a true champion for Greta and our entire family. Part of her job is that she's able to see the big picture of what's coming and what we should do, while my husband and I are just getting through day-to-day. Now that I look at it on paper, she sees neurology, seating and orthotic specialists, urology, nutrition, psychology, and a sleep specialist. Part of her treatment includes getting Botox injections that helps with her muscle tone. And she also has a deep brain stimulator, which helps her control her involuntary. My husband and Leif and I were introduced to Medicaid just a few days after Greta was born. At the time, we carried private insurance like we do now, but Greta's needs would exceed what private insurance would cover. And the social workers at the clinic knew that and got us help right away. Be a ninth grader in high school. She absolutely loves school, and she rates it a 10 out of 10 every day that I ask her. It's a really big positive part of her life, and she depends on those paraprofessionals to make that a possibility. Medicaid also funds personal care. Leaves that in our family. Medicaid also provides Greta with an AAC device. We call it a talker, and what it is, it's a computer that's activated by her eyes so she can say what she's thinking. I got a little emotional at this part upstairs with the legislators, so. It is absolutely essential to the life we want for our daughter and the life that she deserves. And that's ultimately why I'm here today. Medicaid, or medical assistance in Minnesota, is not an option for the people you're going to hear from today or for my daughter. It's absolutely essential. Requirements. She will most certainly be impacted by any related cuts to the state Medicaid budget. As you can imagine, yesterday's announcement about further cuts to Medicaid has left us with a lot of uncertainty and anxiety about her future. So I'm child and our children, and we depend on systems that allow them to live and learn and participate in community and their lives, and Medicaid is that system for us and many others. Our family counts on it to provide in order to give Greta the opportunities we've dreamed of for her, fundamental.
in the next year. Responsible, trusted providers have invested heavily in compliance infrastructure, internal auditing systems, and new supervision ratios. This leads to a comment that I have to address from the committee hearing in the House on February 23rd, and the false narrative that it has caused and that we example. MAC is a nonprofit, and we have been for 30 years. We operate on razor-thin margins. At the end of December, prepayment review went into effect, and we were not paid the amount owed to us for 2 revenue cycles. So we are now behind a significant amount of money. We've done everything we were told we needed to revalidate all locations, which for us is 18 centers. This is hundreds of pages of documentations, and it's a $700 per center revalidation fee. As mentioned, we need to apply for provisional licensing and also before May 31st. Had to weigh these costs with the continued sustainability of making payroll for our staff. We finished revalidation yesterday, and we will take the next 3 months to systematically add our 18 centers, not because we're fraudulent, but so that we can spread the cost of the $35,000 in fees across to go. They cannot go to school. In fact, they've been referred to us from the schools. And parents' last option would be to drop them in emergency rooms, which we know are woefully understaffed and overburdened already. Minnesota's children with autism deserve access to their medically necessary treatment.
Alliance. Welcome, Tom.
Thank you. Good afternoon. My name is Tom Smart. I'm a 61-year-old resident of the city of West St. Paul. 10 years ago, I survived a sudden cardiac arrest. Drivers found me clear whether I would awaken, but I was back home in a week and ready to begin rehab as an outpatient. My heart function recovered quickly, but the lack of oxygen during the cardiac arrest caused persistent cognitive impairment, which disqualified me from returning to work. Turned to Minsure, which offers medical assistance based on my income. In January, I'll need to disenroll from medical assistance because I don't meet the new federal Medicaid work requirements. It's unclear whether I'll qualify for an alternative plan. To my community, I was a real person with an obvious need right before their eyes. Maybe Washington sees me as an abstraction, so I'm standing here today to remove that abstraction from Minnesota state lawmakers. Proud. Thank you.
So for our fourth speaker, we'll hear from Rochelle Schultz, who is President and CEO of Winona Health.
Thank you. And I'm here because, to talk about just HR 1 and what that bill does with Medicaid, and is a direct threat to our communities and our people across the state. I wanted to specifically talk a little bit more about rural and some of the elements of that bill, work requirements as an annual renewals right now. We've increased that burden in an already difficult system for people to navigate to twice a year. The system in Minnesota, the Maxis eligibility system, is 36 years old. And this system, there's only 10 states across the United States where high or higher in those rural areas. And the patients that we serve are low-income mothers, their children, grandparents in nursing homes, veterans, and people who are working folks but just don't have access to health insurance. And when they lose their coverage, that doesn't mean they don't need care. It just means they're serious peril right now. This is a statewide crisis that is further accelerated by the HR 1 bill, and rural hospital closures aren't hypothetical. We are seeing closures of services, closures of facilities such as nursing homes, and nearly half of those are children. The remaining people are the parents of those children, whether they're single or married, low-income working families, elders, veterans, and folks with disabilities. 80% of the babies that have been born this fiscal year in my facility are born to moms improving the health status of patients. And we've continued to look for ways to align care delivery and financing that makes sense and is responsible. The healthcare ecosystem is deeply connected and intertwined, and changes to payment policies, funding programs, or regulations are rarely done in isolation. for a very long time, and we are now in uncharted waters. Thank you.
Thank you, Rochelle. I think you took my talking point.
Thank you, Tina. Thank you for coming today. I wanted to share a few thoughts from our colleague, Julia Nelson. Society of Minnesota. She is also autistic, multiplied disabled, and she is a Medicaid recipient. Special it creates opportunity. Programs like MAEPD open doors for working adults with disabilities to pursue meaningful individuals can grow, contribute, and thrive. When people with autism and other disabilities have access to Medicaid, employment supports and belonging. Employees build relationships with coworkers and neighbors, become visible and valid members of their communities. And individuals can move towards greater independence. That means fewer emergency services, less reliance on high-cost are investments that reduce long-term public costs while improving quality of life. Third, employment is both financial and social. Employers benefit from loyal, skilled employees. Communities benefit from increased economic by chance. They require policies that fund person-directed supports, allow employment in any sector without arbitrary we see every day transformative employment is. We know the potential that is unlocked when people are given access to real jobs. Medicaid programs that expand employment opportunities. Programs that enable people to work where they want, engage with their communities, strengthens families, workplaces, and our entire state. Lastly, I want to add, this isn't Julian, this is Kurt Rutzen talking. If we don't do all we can to turn this around, we need to. Thank you so much.
Thank you, Kurt, and thank you to all of our speakers. We have a few minutes left on the clock, and I heard that you may have.
Sarah mentioned that $260 million being withheld by the federal government that was announced yesterday. Can you all talk about how that will affect providing these services of people who do receive these services and what that looks like in terms of all of the money that has been kind of moved around recently?
At this point, this early in the process, we don't really know. There's no real answer to that question. One is the withholding of the funds. We don't know if the state will meet whatever conditions the federal government is placing on that. It's a question of drawing down the federal matching funds that are supposed to come with that. And, roughly 8% of that is being withheld. That's no small amount, especially for a state that's already facing, at least in the next biennium, significant budget challenges. And so how this But in the announcement, CMS indicated that they will continue this through the year, so about $1 billion over the course of a year if that comes to play. And so this is back of the napkin math, don't, whatever, but that roughly equates to about 8% of the employee or representing the university. I'm just here as an individual. Thank you.
Question perhaps for some of the providers up there off the back of this issue. If I'm someone whose paycheck relies on this Medicaid system or I rely on it for my healthcare needs, what should I understand?
Licensed services and supports to many of the individuals that live in our settings. I think, as was just stated, we don't know at this moment the short-term impacts. What we do know is DHS is working tremendously hard to come into compliance with whatever individuals that we support. We need to continue to be engaged. We need to be at the table when these decisions are being made, because if this turns into a quarter after quarter type of withholding or deferral, then policymakers are going to have to make different decisions, tough decisions to the what ifs, and the best thing that I can say for all of us right now, whatever stakeholder group we are in, is be engaged, be vocal, talk about the impacts, and really do exactly what the folks did up here today is and it is powerful, and we just need to use it effectively and tell that story. So.
Thanks, Josh. And I'll just, real quick, I'll just add that if you don't know whether somebody in your life is on Medicaid, I'll just say that like I said, disability services, hospitals, rural hospitals, metro area. So I just wanted to add that.
Yeah, Rochelle Schultz, CEO at Winona Health. I think, what people need to, understand is Medicaid there's a timelines come up, whether that's around work requirements or the, 6-month cadence for renewals and eligibility. And how do we get in front of all of that? How do we help, folks, navigate all of those kinds of things? At the end of the day, our hospital is open 24/7, 365, and it won't. And we don't want to cut any services. Everything that we provide in our communities is there because that's what our community needs. So I think it's a very challenging time for all of us, and I think at the end of the day, we have to all understand every one of us is a stakeholder in
Questions come up offline or later on, you can reach out to us. And I think Laura would be the contact for that, correct? Okay. Thanks, everybody. Thank you all.
Before you leave,